This short video will introduce radiotherapy for breast cancer. We hope it will answer questions and any initial concerns you may have. This video is not designed to replace the initial information provided to you by your oncologist. What is radiotherapy? Radiotherapy uses high-energy X-rays which are targeted precisely to any cancerous cells that may remain in the breast, chest wall, and if required, lymph nodes. Unlike normal cells, cancerous cells are less able to repair any damage caused from radiation. Here you can see the machine and the therapist controlling the machine. The radiotherapy pathway. Radiotherapy requires a number of crucial processes. Following the initial consultation with the oncologist, you will attend a planning appointment. For this, you will need to have a CT scan so that we can ensure the treatment area will be accurately and consistently targeted. Shortly after, you will begin your radiotherapy treatment. Radiotherapy is given over several days and you will be told how many times you have to attend for treatment by your care team. Once the course of radiotherapy is finished, you will meet again with the consultant oncologist for a follow-up. During radiotherapy, we strive to ensure you are well supported and your side effects are effectively managed. You will be invited to attend weekly reviews and informed which days this will occur when you start treatment. Your planning appointment. You will attend a CT scan appointment lasting 45 minutes. As said previously, please arrive 30 minutes prior. The oncologist will use the scan to map out where the treatment needs to be aimed, and this will be your individual plan. You will be asked to remove all your clothes from the waist up and change into a gown. Please breathe normally unless advised otherwise and keep still. It is important that you are relaxed. During your CT scan, the radiographers will ask you to lie on specifically designed equipment and they will move your chest area into the correct position. A few measurements will be taken and small marks will be drawn onto the chest region. The radiographers will let you know when they are ready to leave the room and start the scan, and they will watch you throughout the procedure from outside. If you experience any discomfort, please raise a hand. The scan itself only lasts 5 minutes. You won't see or feel anything, and it's very important that you keep still. Once the CT scan is completed, the radiographers will enter the room. The couch will be elevated, so please do not sit up straight away. What happens after the CT scan? You will be given a date for your first radiotherapy treatment. This usually starts in 2 to 3 weeks. The time between the CT scan and the first radiotherapy treatment is used to check your individual plan and make sure it is ready to deliver. This is not a diagnostic scan, so you will not receive any results of the scan. It is only used to plan your radiotherapy treatment. Your individual radiotherapy plan. There will usually be 2 radiotherapy beams used for breast or chest wall treatment. Lung irradiation will be minimised. No 2 plans will be the same. The treatment is planned to an individual's body shape and diagnosis. What will the treatment look like on you? The following yellow shaded areas indicates where the treatment is typically delivered. If you are having your lymph nodes treated, your individual plan will look like the one shown previously, except there will be 1 additional beam as shown here. The additional beam is directed to the collarbone region. Your consultant would have informed you if this treatment is required. Not every patient will have this treated. What will this treatment look like on you? This will only be those that are having their lymph nodes treated. The yellow shaded area indicates where the treatment is typically delivered with the addition of a beam directed to the lymph nodes. Deep inspiration breath hold radiotherapy, otherwise known as DIBH. DIBH is only used for left-sided treatment as the heart sits behind the breast or the chest wall. DIBH is a technique whereby you hold your breath during the planning session and daily treatment. Taking a deep breath in and holding allows the breast or chest wall to move away from the heart to allow for optimised planning. You will be asked to take a deep breath in and hold for a minimum of 15 seconds and a maximum of 20 seconds. During your planning session, the radiographers will provide you with coaching in regards to the required breathing pattern. What happens on my first day of treatment? On the first day only, please arrive 30 minutes before your scheduled appointment time. Your first treatment will be approximately 30 minutes and subsequent treatments 15 to 20 minutes. Please use a signage to direct yourself from the main entrance to the reception area. Please check in at the reception desk and take a seat. This is what you need to look for. This is the Linac treatment waiting area, and this is where you need to wait on your first day. How will I know when it's my turn? One of the radiographers will come and find you near to your appointment time for a first day chat. They will discuss the procedure and answer any questions you may have. They will provide you with a list of the first week's appointment times. They will ask you to change into a gown before entering the treatment room. Remove clothing from waist up only. If you prefer, you can bring your own dressing gown. Am I in the right position? The radiographers will help you onto the treatment couch and they will need to see your tattoo marks. You will remain covered as much as possible. They will adjust your body, the couch and the treatment machine to the required position. Keep still and relax, and breathe normally. Once happy with your position, the radiographers will leave the room to control the machine from outside. You will be watched on CCTV cameras at all times and they can communicate via an intercom. We understand remaining alone can be a daunting experience. Let the radiographers know if you feel anxious by raising your hand. They are able to stop the machine and come into the room. X-ray images are taken during treatment to confirm your position, and each patient will follow an individual regime. Align RT. What is Align RT? Patients naturally move during treatment, and Align RT is a form of advanced technology that will detect motion during treatment using 3 infrared camera units. If you are to move even by a millimetre, Align RT automatically pauses the radiation. Once back in position, the treatment continues. This ensures accurate treatment to the target area. The radiographers will inform you if this is part of your regime. Does it hurt? You will not feel anything. You will see a red light directed from the ceiling cameras onto your body. The red light will not affect or hurt your eyes, so you can keep them open if you wish. So let's dispel some common myths and patient views of radiotherapy. Is radiotherapy painful? No, radiotherapy is not painful. You will not feel or see anything during treatment, but you will hear a buzzing noise as treatment is delivered. Will I become radioactive? Radiotherapy does not make you radioactive, and it is perfectly safe for you to interact with others, including children, after treatment. Will the machine move on its own? The machine does not move on its own. It is programmed by the radiographers inside and outside of the room. You may feel anxious that you will be enclosed by the treatment machine, but this will not happen. The machine can move around you, but no machinery will press down onto you. Can I start and stop treatment as I wish? Radiotherapy is a commitment. Treatment is delivered over a Monday to Friday and, if needed, a bank holiday. Once you have commenced radiotherapy, it is crucial you do not miss treatment days, as this may make your treatment less effective. If you are unable to attend for any reason, please discuss with a radiographer or telephone your specialist cancer nurse. Your weekly review. Each week you will have the opportunity to meet with a review radiographer during your course of radiotherapy. Patients are encouraged to utilise this forum to express any concerns they may have whilst having treatment. Review radiographers are happy to answer any questions. They are also available via phone when you are not in the department. Your side effects will be monitored and appropriate advice given. So let's go through some of the general side effects to start with. Radiotherapy affects people in different ways, so it is difficult to predict exactly how you will react to your treatment. Side effects generally only happen in the area being treated. Side effects occur gradually, and you will not notice anything after one session of radiotherapy. The side effects tend to start towards the end of the second week of treatment and will be at their worst 10 to 14 days after the course of treatment has finished. Most side effects are temporary, and generally people notice a significant improvement 6 to 8 weeks after treatment. Some side effects may last for a few months following treatment, and others which can be permanent. This can be discussed during your weekly review with a review radiographer. Skin reactions. The breast may become tender, swollen and pinker in colour, similar to a mild sunburn. If the skin breaks, discontinue applying cream and ask for further advice. Review radiographers can provide dressings to soothe itchy, blistered skin. There may also be short shooting pains and twinges. They are usually mild but can continue for a while after treatment. What can I do to help myself? First of all, do not panic. The radiographers will assess your skin daily and refer you for specialist advice and, if needed, dressings. Utilise a moisturiser that does not contain sodium lauryl sulfate at least twice daily. Do not use this on broken skin. You may continue to use a deodorant unless the skin becomes irritated, preferably not aerosols, and avoid shaving on the affected side. Shower with a mild, unperfumed soap in tepid water. Pat the area dry, do not rub or scratch the area. Wear a soft cotton, non-wired bra. It may be necessary to avoid wearing a bra once the area becomes tender to avoid friction. Utilise a high-factor SPF once radiotherapy has been completed for at least the first summer and shield the area from direct sun exposure. Avoid swimming during radiotherapy and afterwards for at least 3 months. Tiredness and fatigue. Radiotherapy can affect your energy levels, your motivation and emotions. Your body will use a lot of energy over the course of treatment, and added to the travelling and anxiety of this, you may feel tired. Fatigue can continue after radiotherapy has finished and may last several weeks. We encourage patients to carry on with their daily activities where possible. Equally, allow time to rest. What can I do to manage tiredness and fatigue? Plan your day in advance and try to incorporate regular gentle exercise. You may consider working from home or alternating your working hours. Consider complementary therapies offered at the Royal Berkshire, such as mindfulness, aromatherapy and massage. Ask the review radiographer for more information about this when you start treatment. Maintain a balanced diet and aim to drink plenty of fluids, approximately 2 litres per day. We understand you may have apprehensions during the process of radiotherapy which need addressing. Don't be afraid to ask your healthcare team regarding hot flushes, emotional support, fatigue and other concerns. There are treatments and support schemes available depending upon suitability. My radiotherapy has finished, so what's next? You will receive a letter for a follow-up appointment with your oncologist, approximately 6 weeks after radiotherapy finishes. Patients receiving Herceptin treatment will be reviewed every 3 months in the Herceptin clinic. For all inquiries, contact us at the Royal Berkshire Hospital on 0118 322 7872.